Here at Explore Lab Science, we provide science education to K-12 students. Going to the doctor can be overwhelming at first, but it doesn't have to be. Today we'll go over some of the basic exams you can expect at the doctor's office.
Basic eye exams can be done either at an eye doctor or at your regular checkups by your physician. The purpose of this is to check to make sure your eyes are healthy and to see if your vision has changed since the last time you got your eyes checked. To do this, doctors use what's called an eye chart, as we can see here. The doctor will put you 20 feet away from the chart and ask you to read different letter sizes. This tells the doctor how good your vision is from the distance you are standing. You may have heard the term 20/20 vision. This refers to someone who has perfect vision, so if you have 20/20 vision, you can see what the average person can see from 20 feet away. The doctor may also cover one eye at a time to see if there is a difference in the vision between your eyes. They may also have you follow an object with your eyes to make sure that they can focus on and follow the object, and to check your peripheral vision. This means they are checking how far you can see to either side of your head while looking straight ahead. Based on what they see in your eye exam, the doctor can help you by prescribing you new glasses or contacts.
Your doctor will also examine your eyes, ears, nose, and throat for any discoloration, wounds, or abnormal shapes. They'll also be looking for specific bodily reactions. One example can be seen in the eyes. When a pen light is pointed directly at the eyes, the pupil should constrict as shown.
We are going to be talking about heart rate. Your heart is located a little to the left of your chest. When going to the doctor, they often have a tool called a stethoscope. A stethoscope has 3 parts: the 2 earpieces, which the doctor puts in his or her ears, and then a long tube that is placed on the patient's chest. A stethoscope can help the doctor listen to your heartbeat at a louder volume than with just using their ears. It can also help measure people's breathing along with their other body sounds. The heart is a muscle, and muscles work to move things around our body. Some muscles are voluntary and we can control them. Other muscles are involuntary and we cannot control them, like the heart. Before each beat, your heart fills with blood. Then its muscle contracts to push the blood out. When the heart contracts, it squeezes. Try squeezing your hand into a fist. This is similar to the heart contracting. A normal resting heart rate is 70 to 100 beats per minute. For older kids who want to try to measure this and who don't have a stethoscope, you can count how many beats you hear by measuring your pulse. Place 2 fingers on your wrist until you feel a beat, then count the amount of beats for 15 seconds. You can multiply that number by 4 to determine your heart rate.
Blood pressure is the force of the blood in your body and is an indicator of heart health. Blood pressure is measured in 2 numbers, systolic and diastolic. Systolic represents the heartbeat and diastolic represents the rest in between each heartbeat. A normal blood pressure is less than 120/80. To measure blood pressure, your provider can use a cuff and stethoscope. When the cuff is inflated, the blood pressure can be heard through the brachial artery, known as Korotikoff sounds. They will listen through the stethoscope while deflating the cuff and watch the dial define your blood pressure. When the Korotikoff sounds begin, that number is your systolic, and when they stop, that number is your diastolic.
The patellar reflex, also known as the knee-jerk reflex, tests certain segments of your spinal cord. When the patellar tendon is tapped with a hammer, the quadriceps muscle contracts and the leg kicks outwards. You can make your own hammer using 2 pencils, an eraser, and some rubber bands.
Sometimes when visiting the doctor, they need to look at our blood to see if it can tell us more about what might be wrong, or just to make sure everything is going alright. To get blood taken, someone called a phlebotomist will help you. The first step is to apply a tourniquet, which is like a big, tight rubber band that goes around your upper arm to stop blood from flowing back to your heart, which allows it to pool in your veins, which makes it easier to draw blood. They may also have you squeeze something like a ball to increase blood flow, making the blood come out faster. Next, the phlebotomist will feel your arm below the tourniquet to feel for your veins. This makes sure they insert the needle in the right place and in a vein where it will come out the easiest. Now the phlebotomist is ready to insert the needle into your arm to quickly and easily collect your blood. After your blood is collected, medical laboratory scientists will look at its different components to see if they are normal or not. To learn more about the components of whole blood, we are going to make a model of blood using candy. For this experiment, you will need a jar, red hard candies such as Red Hots, sprinkles, mini marshmallows, and corn syrup. First, we will add the red candies, which represent red blood cells, into the jar until they fill it up about 44%. This is because red blood cells make up about 44% of whole blood. Next, we will add a few of our mini marshmallows, which represent white blood cells. They make up only less than 1% of our blood, so we don't need a lot. Our next component to be added are platelets, which are being represented by our sprinkles. They too, like white blood cells, make up less than 1% of our whole blood, so again, we don't need to add too many. Finally, we fill the remainder of the jar with our corn syrup, which represents plasma. This is because plasma makes up the biggest part of our blood, the remaining 55%. Now we close the lid and shake or mix everything together, and we get to see what the components of our blood look like all together.